Hey everyone, Ron Vaughn here again. Thanks for responding. I had a request to work on hip flexors. Hip flexors, do you know what the hip flexors are? They flex the hip, but which muscles are they? They're just here somewhere, right? Well, I'm going to show you how to actually touch the specific muscles, all right? And then you can massage them yourself, and hopefully it'll give you some relief. And it would also help you with some lower back pain. So here we go. Okay, for this episode, we're going to use this book as a reference. I love it. I'm going to use the MOBO. MOBO's pretty cool. It's good for this, what we're going to do today, for some of it. And then we have the good old remember, not only do you need to roll, but you need to rock it. Yeah. So, here we go. The hip flexor. It's in this general area. So, here's a good picture right here. Now you see all these muscles here. So the psoas is part of it. The iliacus is part of it. So Taurus, we got your IT band around here, quads, your adductors, inside here, okay? And so a lot of these muscles contribute to lifting your leg, okay? So if I take away this rectus femoris here, okay? And then you see the intermedialis. This is a big one as well. So not only the quads have a lot to do with it, but the sartorius, all right? And so here's where they attach. So if you were looking at your adductors, okay, they attach here, that helps lift the leg, got it? Now you can see, take more muscle away, your quads, the vastus lateralis attaches here, the psoas attaches right here, along with the psoas as well. They both attach in this area here, which the psoas major comes up here, comes down and attaches here, okay? So just here, down here, we're kind of taking this out, all right? So we're looking at this even more, it's taken away. See how the iliacus inside here, sartorius attaches here. The sartorius was that one muscle. It went from here down to your knee, okay? It attaches to right in here. See all that? Sartorius, semitendinosus, gracilis, all that attached here. That's where the pes and serenus is. All the muscles are gone. This is just the bone markings, okay? So this kind of gives you a general area where we're going to be touching today. And that's it for that. Oh, one more thing. So you've seen a lot of videos or seen people suggest that you put like a ball here or something and lay down on it when you're laying on it. Okay. I have a hard time doing that because it's it can be dangerous. So this next pic here, all right, this shows you, and anytime you put something here, a ball, you have a chance. That's the muscle you want to get, but you also have a nerve on top of that, and you got your arteries here and your nerves are here, closer to the groin area, right? And so this is you have a ligament that goes from here to here, which is called the inguinal ligament. Okay, so you don't want to press on that. You don't want to go too far inside and press on that. So you just got to be careful when you're doing stuff like that. Here's the iliacus right here. That's the psoas. So those muscles, you have to be careful when you're putting an object in here, right? Because you could be pressing that. So, and also, just hitting this part of the muscle, the psoas, is not going to release it. It attaches up inside here and down on the inside of your leg. So there we go. And now it's time to demonstrate. Okay, first psoas. So you may have seen me do this in the previous video, but I'm going to show you again. So remember, one of the best ways to find your psoas, so you find your bone, your hip bone, follow that, and right in the inside here, you're going to like lift your leg up and you'll find that muscle, okay? And you can bend your knee to find it. So you want to kind of like go side to side. You don't want to like stab it or push it hard. It's all about trying to get movement, okay? You find it there, you're like, oh, there it is. You bend your knee here once you find it and move a little bit. Other side as well, okay? Now, you know where the hip bone is. So right inside is the iliacus, right? It's right in there. Same thing there. You want to kind of like, this is your true hip flexor because that actually flexes the hip, okay? And so that's the one where when you're sitting at work a lot for how many hours, then you get up and walk and you go, ah! You walk around, you're like, oh, my back. That's it, okay? Right inside here, okay? It's better doing it laying down, that way you don't have to compensate your body. So you got that going on. So that's, and then if you can also follow the psoas all the way up to the deep into your spine, on the inside of your spine. You can find the attachment for your psoas. So you have to breathe and let your hands just sink into there. It's kind of like jello, kind of just sink in there, and you find it. You can find it right there. Woof. And you got to be careful because there's nerves in there, so you don't want to push real hard. You just want to kind of find it and kind of just move the muscle, get some blood in there, okay? So once you find it, get your hands there. Now you can kind of lift your leg. Let's see how my legs are bent. Kind of bend it, straighten it out. You can also go up and down until you find it. All right. You go side to side a little bit. You'll feel it in the back. It's pretty crazy. So it's really sitting. So it's not so much hard. You do just being able to find it and touch it and then move it. Okay. Good. All right. Now on the inside of the leg, see, it attaches like right. So there's the crease. So it attaches right here. So that's where the psoas and the iliacus comes in, right in here. It's on the femur, inside the femur, right there. Oh, the lesser trochanter, and that's it. Ah. So you just kind of want to rub a little bit, little rotation in and out. You know, try to get some movement. You can move your leg a little bit. Yeah, that's it. The other side as well. No, that's not as bad. Oh wait. Oh yeah, there it is. Ah! Okay, so that's the inside. That's the insertion of the psoas and iliacus, okay? Way down in here. Alright, so next, sartorius. Sartorius attaches to the inside of your hip. Do you remember the markings on the book I showed you? Hip, okay, comes across here. Comes across here on the inside of your knee. So it attaches like right in this area. You see where I has ACL surgery? That's where it all attaches. So when they go in and cut for surgery, scar tissue builds up. And what happens with scar tissue? It limits the muscle's range of motion. So it's hard to get your knee to move. So anyway, after you have surgery, if you have surgery, definitely like massage that area to break up the scar tissue. But anyway, okay, switch your knees. You can find it here. So another good way is when you put your hand here, your finger here, move you can straighten your leg out and you'll feel the muscle moving and you can find that. And so same thing here, kind of like, you know, massage a little bit. It's gonna, some you may hurt, but just be gentle, just kind of lightly release it here, rub it, get the blood going. Then when this feels like it's letting up, then kind of like straighten it out, bend it. Okay, try to relax your foot. Just do that. And then you can follow it. It comes like under here. So here's the quad. the vastus medialis. So it goes under that, and it comes up in here. So you want to kind of find the sartorius and then the quad. So once you find that, good way is to kind of, when you lift your leg up, that's the sartorius, okay? So you want to kind of release that, find it all the way up, and then you get your quad, same way. Push it away from the bone, not into the bone, but away from the bone. Kind of lift it a little bit, right? You can kind of move your leg like this if you need to. All right. Now, that comes up, crosses over here, and you can find it. You're going the same area as the iliacus, but instead of inside the pelvis, you're right on the tip, right on the edge there. And you'll find it, like I said, same thing, just kind of move your leg like this, and you can find it. Like there it is, right there. Ha! And this could be tender, some people. Whew, feels good though. Whew. You do one, get here at the same time. You go, wee! Ah! But if you don't know where it is, move your leg, because that's the tailor muscle. It helps you tailors. You just put the leg up, so this is called the tailor muscle. They put the pants on there and hinge. So for the muscle, same thing. Comes across right here. So anyway, so release that up in there. All right. Next is the quads. So I already showed you the vastus medialis. Now the to get to the intermedialis, which is the muscle on the very bottom where we took the rectus femoris away, it's right down there. So you come find this medialis, go a little more, you can find the intermedialis is right there. Ooh, yeah. Same thing, you can flex it, you can move your leg, kind of release that there. Yeah, ooh. And quad, there, intermedialis. Okay, attaches up, and they all attach. These quads attach right here. I don't know if that one episode, right here. Also on the, this is the trochanter on the opposite side of the left trochanter, right here in the femur. Okay. All right. Once you get that, now the vastus lateralis. By the way, I had some cupping done the other day, so that's why I have markings. It's not a polka dotted leg. So the vastus lateralis is right here. Yeah, all that there. IT is here. You can see the IT attachment here. Quad is here. Okay? IT is not a muscle, but the quad is. So release the quad. Okay? Release the quad. Flex. Release the quad. Alright. I got the markings to show you where muscles they were trying to get. But anyway, you see the intermedialis trying to kick in. Lateralis, medialis. Alright. Alright. Now, the adductors. The adductors are so important. With the adductors, if you don't release the adductors, your hamstrings and quads, psoas are doing twice as much work, maybe 3 times. But the adductors allow movement in that hip because they all attach to your pelvis, okay? And so if we can get the adductors to move, it makes life much simpler as far as running and jumping and moving, okay? So adductors, kind of like the same way you got your, let's do this leg. Oh. So you got your quad, surgery, quads here. Now find the inside of the bone, okay? Adductor. Yeah, all in here. And just remember the picture how it all attached down here. It attaches to the inside of your pelvis, right? So it's like, so you've got to not get the sartorius, but the adductor. it's kind of like find a sartorius and then go right under here and right on the inside of the bone there. Right there. Oh. Yeah, right there. Yeah. You kind of get it moving there. Same thing there. You kind of move your leg a little bit. Get right in there. Yeah. Right inside here. And you can feel it when you go and follow it all the way up, all the way to your pelvis. And that would be, it's kind of hard to show you, but it's like right in there. Right on the pelvis bone. Woo-hoo-hoo. All right. So, you saw what the picture of the attachments were. So, hopefully that helps you. But get those adductors moving, okay? There's so many in there. And you've got one that attaches right here on the inside. Just follow it up. Follow it up. You know, it's not the sartorius, it's the adductors you're looking for. Yeah, right there. Sometimes you get some of that quad as well. When you get off the quad to get the adductor, which is a little more right in there. Okay? So adductors. Alright. Alright, I wanted to show you another angle of the adductor attachments. So this is your adductors, okay? This is the back. This is where your glute would come in here. So your adductors actually attach right in here. So when you have it on the inside, you're kind of reaching, like, you're reaching more towards the table, okay? And so you see there's a lot of markings here, and that's where they all attach. Look at that one, look at all that. That's where all your adductors attach. Alright. Adductor brevis, pectaneus, adductor magnus, and even down here is where your bicep, see where it is? Oh, there's, I dang it, adductor. Oh, they're just, sematilosis, oh, adductor magnus, that's what I was trying to show you, that adductor magnus right there. Alright. So there you go. So your adductor, okay, you got your sartorius, comes here with the pes, goes around, you get the pectaneus in there, there's a gracilis, my bad, gracilis, touches right in here, and then so, imagine that, and then your adductors are right, it's almost kind of like below your hamstring, so it's kind of like on the side, it's like on the corner of the bone, kind of, like, aim for that area, like right in there. So do yourself, kind of relax, kind of get in there, and you can feel it when you move your leg back and forth. So back here, you can feel the adductors, and they're attached to right here in front of your sits bone. Okay, so now you know where that kind of is. Okay, so just kind of massage it, get in there, kind of move your leg back and forth. You can feel it moving. All right, so you want to really saw that. Okay. Whew. All right, now we have the MOBO, and yes, they did send me a product, and I'm using it. I like it. This is the newer version. They have like 3 versions. This is pretty cool too. They have a smaller one I like a lot too. Anyway, I'm gonna show you how to use this one. So if you have a MOBO, or if you want to get one, MOBOsystems.com. I think that's what it is. Anyway, so same way as the Psoas, you can stick it in here, right here, fine. So find your pelvis, the tip of the pelvis, edge of the bone there. That's iliacus, and move to like just a little bit, not too much. Find that Psoas. Like I said, and lift your leg up if you need help finding it. Okay? When you need, you find it, hold it, and kind of rock it back and forth. Rock it! Yeah! Side to side! Lift your leg up if you need to, kind of get it moving. Alright? So, you go a little higher, you get to the You may be able to get a little more of the attachment of the deeper spot. Yeah, right there. That's it. Yeah. Remember, don't stab yourself. Just kind of let it sink in there. Find it, because the harder you don't want to push too hard. You just want to kind of just let it be. Okay, don't force it. All right, right in there. Okay, got it. Woo. And then for the that was the origin of the psoas and iliacus. Same way, in more angle. Find it right there. Same way you can do that. Lift your leg, get it released. Okay. Woo. Now for the attachment, the insertion is right here, the inside of the femur. Gotta find it with my hand first, like right there. You can put that MOBO right there and move it a little bit, yeah. And you can rock it, yeah. Side to side. Move your leg. If you can't find it, there, found it. Oh, there it is. Okay, got that. All right, next, your sartorius, same way. Find the pes. You kind of massage all that here. Sartorius comes around. Quad, release all that quad in there. But I would do it on the side this way, because that way you can get, you don't have to work so hard. Just kind of find it, massage a little bit. Same here. Work it back and forth. Rock it, yeah. You can get your adductor as well. Adductor's way down in here, yeah. Oop, not the hamstring, but the adductor. Right in there. You want to rock it, yeah. Side to side, yeah, right there. All right, it goes all the way up to your sits bone area right in front of that. Okay, so go as far as you can go, right there. But that's if you have one of these. Okay, so thanks, MOBO, and look for more products soon. Ooh. All right, commercial timeout. ATP, got the little trailer sticker. Friend of mine made this. Matt, thanks Matt. Love you, bro. All right, foam roller on your belly, on your back. So there's not much you can do. I mean, you can kind of dig in there, but it's not going to do much, okay? But you can roll out and rock your quad, your intermedialis, get your sartorius right here, a little bit of pes. You know, you roll it and rock it, yeah. So rock and roll, baby. Roll it, rock it, side to side, side to side, side to side. Ah, yeah. And then you can also, I think I showed you this on the other video, but once you get that, so you can see how when you do this, the muscle is moving side to side because I am rocking, yeah. All right, side to side. You can see the muscle moving. Woo. Okay, all around the world. You're looking for me. Woo. All right, and IT band again is not a muscle, it's just a band. So if you really want to release IT band, it's right here. It attaches to the, not to the femur, but to the little tip down there. And right here, you can also rock it, roll it, yeah, rock it, rock it, rock it, rock it, yeah. All right, you can shimmy, 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 kokapa. All right, so that's that. Yes. All right, foam roller on your belly, on your back. So there's not much you can do. I mean, you can kind of dig in there, but it's not going to do much, okay? But you can roll out and rock your quad, your intermedialis, get your sartorius right here, a little bit of pes. You know, you roll it and rock it, yeah. So rock and roll, baby. Roll it, rock it, side to side, side to side, side to side. Ah, yeah. And then you can also, I think I showed you this on the other video, but once you get that, So you can see how when you do this, the muscle is moving side to side because I am rocket. Yeah. All right, side to side. You can see the muscle moving. Woo. Okay, all around the world. You're looking for me. Woo. All right, and IT band again is not a muscle; it's just a band. So if you really want to release IT band, it's right here. It attaches to the, not to the femur, but to the little tip down there. And right here, you can also rock it, roll it, yeah, rock it, rock it, rock it, rock it, yeah. All right, you can shimmy, 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 kokapa. All right. So that's that. Yes. Right now, foam roller. How are we going to use those adductors on the foam roller? So you see at the gym or places where people are doing this, they're like trying to roll their leg out, right? First of all, you don't just roll it. You got to rock it. Yeah. Side to side. Okay. So here's what I show my clients to do, and it works, okay? It looks kind of weird. Kind of, you'll like it. So, foam roller. Bring it all the way up as high as you can go, okay? So you don't have to squeeze it, just kind of let it sit there, okay? And you want to walk. So you want to walk, 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 walk. You don't have to worry about duck walking, but some of you might because it hurts. So the more you walk, it's going to slide down toward your knee, which is okay. Just bring it back up, okay? Because if it does that, it's massaging all those adductors in your quad as well, okay? So, walk, walk. I call this the foam roller walk. You want to call it the frock. Frock it. Yeah. All right. Frocking good time. Go backwards. You can also go side to side, karaoke. Woo! All right. So that's one way to get your adductors. Got it? With the foam roller. Like I said, let me know what you think. Thumbs up, thumbs down, sideways, whatever. So this video